It's episode 40 of the Healthy Reasonings podcast, and today I'm going to reveal to you my secret weapon. Let's go.
Welcome to the Healthy Reasonings podcast with Dr. Andre. You are now listening to your number one source for clear, unfiltered conversations about your health and wellness. Join us every Tuesday for success stories, educational topics, and interviews with wellness experts from around the world. You can listen to this podcast on your computer, phone, or any other electronic device that streams podcasts, or download each episode and listen to it on the go. Let's get started with today's episode.
All right, so it's 40 episodes of your number one podcast for clear, unfiltered information about your health and wellness. And as usual, we remind you that this is not intended to be specific medical advice for you about your personal medical condition, but rather it's just an indication of the knowledge that is available to all our viewers, all our healthy reasoners, so you can make informed decisions when you discuss your health and wellness with your healthcare practitioner. Today we're going to be talking about my secret weapon, and it is the tool that I use the most every day to help me with finding the right root cause for why my patient or client is not well. So if you come to see me in office, this is what I'm going to do for you. It took me a little while to get it to, I wouldn't say it's perfect yet, but to get it to the point where it looks easy to do. But this technique is called the VitalReflex Scan. Check this video out.
Imagine a breakthrough medical technique that gives you precise information about your health with just the touch of a hand.
The VitalReflex Scan is a tool that I would not want to do without. It is a technique that I use every single day for every single patient, especially if I'm meeting you for the first time. I enjoy doing the test because it is simple, accurate, and helps to identify the root cause of why you are sick. It does not require you to remove any clothing, but you will need to remove your jewelry. You will not have any special wires or equipment attached to you. All you'll have to do is lie comfortably on the examination bed. The VitalReflex Scan is based on the principle of Autonomic Response Testing. There are some reflexes that the body just does automatically. If you doubt me, try sneezing with your eyes open. These are your most vital reflexes that literally keep you alive. During complete health, the reflex responses we get are normal, but when the body is not regulating well, the reflex changes when we stimulate the damaged areas. To do the scan, we place a small device behind the head to help us measure your reflexes. Then we stimulate different areas of the body and use your reflex responses to determine where you are having difficulty. With this information, we can check what's happening with each organ and each region of the body. The test is very accurate because you can't fake your reflexes. In the VitalReflex Plus scan, we can even identify the supplements or remedies that would work best for you. Let's take a closer look at what I actually do. I rest my hand on the area of the body that I think that I want to get information on, and I'll use an assistant who is a third party who will help me to measure the results. I'm trying to find the area where the body is blocked, where the reflex changes. And when I find the blocks, I'm no longer treating the condition that you have described to me. For example, I'm no longer treating diabetes or hypertension or lupus or even cancer. What I'm doing is slowly finding ways to eliminate those blocks so that your body can get itself back into balance. At Teshuva Wellness, we believe that everybody has a unique story, and the VitalReflex Scan allows us to listen to your body's story. We're not here to treat just a symptom. We're here to understand the underlying causes of your discomfort or disease. This approach sets us apart and makes us different because it empowers us to partner with your body in its healing journey. We're not guessing about what might work. Instead, we're using precise insights to guide our recommendations, all while keeping our treatments gentle, effective, and aligned with your body's natural rhythms. Thank you for taking the time to learn about the VitalReflex Scan, and I invite you to book your first appointment with us here at Teshuva Wellness, where we're here to help you to return to your best self.
Don't wait. Book your appointment right now. Call us today at 876-787-8197.
All right, so you've seen the video. There's not much more that needs to be said. I want to share, however, the background to the VitalReflex Scan. As you would have noticed in the video, it's based on the technique of Autonomic Response Testing, which really is a way of interrogating the nervous system. So it's very similar in many ways to a lie detector test. In a lie detector test, though, they hook up all these wires to you and it looks a little bit more intimidating. But the principle is more or less the same. And we've always known as medical scientists that the body operates like a circuit from head to toe. So the nervous system really is, if you want to use the word electricity, it's running on electricity. It's a little bit more technical than that, but we'll leave it there for now. And so if you think of a circuit board, then you'll know that every single capacitor, every single fuse, every single bit of wire or conductor on that circuit board is vitally important for the circuit, the entire circuit, to function perfectly. So for those of you who've ever had a problem with your washing machine or your television or your refrigerator and the repairman says the motherboard or the circuit board is down, what it usually means is that there's one little area on the board that the electrical voltage is abnormal. And similarly, one of the first things we learn in medical school is how the body moves messages around from one nerve to the next. We learn about what we call the resting membrane potential, or the voltage at which particular cells are settled, their baseline voltage. Just the same as if you have an electrical appliance and you need to know what type of voltage it requires to function best. Similarly, each cell in our body operates best at a specific voltage. Now, when that voltage is shifted, or when there's a problem with the body, the cells don't operate at the correct voltage. We're oversimplifying it because it's a lot more complicated than just electricity. But if we are able to devise a technique to measure where the voltage is changing, then we are able to figure out where the body is having a problem. So as you saw in the video, we are now moving away from just somebody coming in and saying, "Hey doc, I have a headache." And me, for example, examining their nervous system the conventional way and saying, well, there's no evidence of a stroke, there's no evidence of any damage to your nervous system, but you still have the headache. And what that usually means is the patient then gets sent for a barrage of blood tests, probably some imaging tests, CT scan of the brain, MRI of the brain, and so on, to try and investigate why the headache is taking place. And to be clear, there's absolutely nothing wrong with those investigations. However, many of the patients who come to see me have already been seen and investigated thoroughly in the conventional way, and yet are still having their symptom or complaint. And so at that time, what we need to be able to do is essentially interrogate the body at a cellular level. It's pretty similar to when you carry your car to the mechanic nowadays, and instead of them checking each individual fuse manually, most garages hook your car up to a computer of some kind, and the computer will essentially give them an overall assessment of where the problem is. So autonomic response testing for me was a game changer. I want to tell you a quick story about how I came to learn about the principles of autonomic response testing, and I'll tell you that right after this break.
Are you feeling tired, drained, or just unable to do daily tasks? Here at Teshuvah Wellness, we have the best solutions designed to restore your energy and balance. Our IV vitamin infusions blend essential vitamins and minerals that deliver the energy you need, right where your body needs it most. This allows you to quickly get back to your best self. Some benefits include improved hydration, enhanced immune function, increased energy levels, electrolyte replenishment, detoxification support, and improved skin health. Whether you're fighting fatigue, boosting immunity, or simply looking to feel your best, our IV vitamin infusions are a natural choice. Return to your best self, feel stronger, more resilient, and more balanced. Ready for a natural boost? Visit Teshuvah Wellness today. Your health journey begins here.
All right, so we're starting off with the story of how I actually developed the VitalReflex Scan. The principle of it is autonomic response testing, which I described a little bit in the previous segment. And the story goes like this. I had left the hospital and was in that phase of my career where I was just being exposed to the possibilities of holistic and naturopathic medicine. And so I was essentially going from one course to the next overseas in the United States. And each time I would go to a workshop, somebody, you know how it is, somebody would mention, hey, have you heard about this particular workshop that you could go to next? Or this person is the best in health and wellness, you should go and train with this person. So I was in Reno, Nevada, and I met this gentleman, a doctor, while I was there training at the workshop in Ozone, and he kept insisting that he wanted to examine me in a specific way. And of course, I just recently left the hospital a few months prior, maybe even a few days prior, and so my mind was still not there. And then he kept saying, can I examine you? Can I examine you? It's painless. It's non-invasive. You don't even have to remove any clothes. I just need to be able to examine your reflexes. And I said to him, no, it's all right. I'm cool. A group of us went out for a tour of I think it was Lake Tahoe. Then we ended up in this little pub or restaurant in Tahoe City, I think it was. And we were there chatting at the dinner table. And this gentleman again, hey, listen, I could examine you right here. I just wanted to show you what's possible. And I said, no, I'm not going to. And he said, well, do me a favor, at least go and train at this particular workshop. And he gave me the doctor's name. And I said, all right, no problem. I'll think about it. Came back to Jamaica and pretty much forgot about the whole thing. Later on, I kept in touch with some of the guys I had met. They said, hey, did you check out the workshop that we told you about? And I said, no. So 1 o'clock one morning, I'm lying in bed. This is usually the time when I do my thinking for some reason. And I have the iPad out. And I'm looking at the iPad and saying, all right, let me just go and look what this thing is all about. So I pulled up the YouTube video and I saw the host for the workshop demonstrating autonomic response testing. And after 5 minutes, I'm like, nope, I am not going to be a part of this. This looks weird. It looks creepy. it looks like it's contradicting even my very faith, my Christian faith. And I said, I don't think I can, this is not for me. However, I prayed about it and I felt like actually this was something I needed to learn. So like I did with other workshops, I put it on my credit card, flew to Seattle. The workshop was being held at Bastyr University. It was like a 7-day training. And I learned the technique. I learned autonomic response testing. It was very difficult to wrap my head around it. The teacher is extremely good, and it's a very systemic way and step-by-step way of learning the principles of how the body functions and why you can test the reflexes to figure out what's happening with the body. And after the week, I came back to Jamaica, brought the equipment with me, and I said, all right, let me try it on, maybe one patient, maybe let's see what happens. And so, of course, having just learned it, it took me some time to really get the technique perfect. So if you watch the video, you'll see me doing it pretty seamlessly. But when you're just trying to put all the steps together, it's pretty difficult. And so there were moments of frustration. There were moments where I say, I think I'm going to put this aside. But I pressed through, and eventually what started happening was patients would come to me, like I described, who had issues that had not been solved in the conventional way. And so they'd come to me and say, hey, can you do any tests to figure out why I'm having this problem? And I said, sure, let's go. So we did the test, and invariably I would find that there was a small area of their body that was giving trouble. And when I found those areas, all I now needed to do was to figure out how to most effectively treat the problem. One of the main things that I learned during those first couple of years, 2017 to about 2019, was the importance of the teeth. And we're going to be talking about that in a few episodes down. Maybe next episode I'll talk about the teeth. But I began to investigate my patients a lot more using my device. And eventually what happens is, after a while you practice something like this long enough, you start to see patterns. And when you see the patterns, then when the patient describes what's wrong with them, you're automatically going to try and examine them to see if the pattern that you have previously identified in other patients exists in them. And over time, I just got better and better at it. Started to get a few patient successes. Patients who had not been previously helped were getting better because I could now pinpoint the actual root cause of their problem rather than just trying to treat the symptoms and chasing them around the body. I'll give you an example. I remember a lady came to see me who had terrible migraine headaches, very, very bad. And of course, she had heard that I could help, but she'd been struggling for 4 or 5 years. So she came to see me, and I said, okay, let's have you lie on the bed. You don't need to remove any clothes. No, just remove the jewelry. I'll put this little device behind your head and let's see what we find. And it was very interesting because what I found wrong with this lady, she had 2 children, I believe, and she had a very angry looking C-section scar. So she had a cesarean section from one of the pregnancies. And I said to her, hey, the test is suggesting that this area of the body is not functioning quite well. Can you recall if you had the headaches before you did the C-section? And she said, come to think of it, I didn't. And I said, all right, how about we use neurotherapy, a tool to help to reset the voltage here, and you tell me how you feel. And of course, you can figure how that story went. The lady she had actually, if I remember, yes, she had a headache the same day when she came to see me, and that prompted her to follow up with her appointment. And she, within minutes of me doing the injection, the headache lessened until it eventually went away. And since that time, she has had little or no headaches to follow. So what we're saying then is, I know with the VitalReflex Scan, which is the technique that I now use to quickly assess patients by Autonomic Response Testing, what I'm now able to do is, without having the patient remove any clothes, without invasive techniques like blood tests, imaging and so on, I can get a pretty good idea at a reasonably cellular level where the problem is likely to be. So it changes the game for me totally, and it changes the game for my patients, because the information that we gain from doing the VitalReflex Scan is so precise that when we do it, we've opened up a whole new world of very, very accurate ways to shift the body, or help the body to shift into healing again. So for example, one of the most common things that I will find when I examine patients is that the gallbladder is very congested. Now, most investigations that we do, medical investigations, would not necessarily pick up on that. And even if an ultrasound were to show gallstones, many times people say, well, if you're not having symptoms, it's fine. And yet, so many people, as you saw in episode, I can't remember which one, we'll put it here somewhere, when we spoke about the gallbladder flush, so many people report having significant improvement in their well-being, and usually the symptoms that they came to me for disappear after doing the gallbladder flush. But the only way to know if it's needed is to do the VitalReflex Scan, check if the reflex changes in the region of the gallbladder, and then apply the appropriate technique to help them to get well. So I just love to talk about the different experiences that I've had since implementing the VitalReflex Scan into my practice. I'm going to tell you a few stories beyond the one I just shared, and I'm going to do it right after this message.
Are you struggling with chronic pain or neurological discomfort? Discover the transformative benefits of the Crown of Thorns Neural Therapy, a specialized treatment designed to reset nerve signaling, reduce inflammation, and restore balance to your nervous system. Why choose Crown of Thorns therapy? It's a targeted relief for migraines, neuralgia, and chronic pain. It's non-invasive and minimally uncomfortable. It uses safe, effective procaine injections and provides quick recovery with long-lasting benefits. Our expert practitioners apply a series of gentle injections around the scalp in a circular pattern like a crown to help regulate your nervous system and promote healing. Many patients experience noticeable improvements even after the first session. Don't let chronic pain control your life. Book your session today at Teshuvah Wellness and take the first step towards lasting relief. Call us now at 876-787-8197. Book now.
All right, so you saw there an ad about the Crown of Thorns. So everybody always loves the procedure after I do it for them. But again, the Crown of Thorns is a procedure that I have to do as guided by the VitalReflex Scan. So I could tell you story after story of patients who have come to see me complaining of headaches, neck pain, tingling in the fingers, for example. What else? Difficulty sleeping, postnasal drip, sinusitis, vertigo, you name it. And what always fascinates me is I'll do the VitalReflex Scan. The reflexes change at the level of the cervical spine or the skull. And I'll say to the patient, hey, the VitalReflex Scan suggests that you have an old injury to the back of the neck or to the head. Can you recall any such injury? Were you in a car accident or anything like that? And they always say no. I've had maybe one or two patients who could say, yep, I know exactly what that is. But almost everybody says no. So then I enjoy situations like those. I'll tell you why. Because I am so confident in what the scan has shown me, the VitalReflex scan, and yet the patient says they have no recollection of any injury to the head or to the neck. And so the question becomes, all right, do I just throw out what the scan is saying, or do I treat on the basis of the scan? And the answer is simple. I treat on the basis of the scan. So I say, hey, we're going to do a crown of thorns for you. And then we're going to ask you to keep in touch with us. Let us know how you feel. What fascinates me is what always happens next, which is I'll do the crown of thorns for the patient and I'll say, all right, go home, get some rest. Call me tomorrow and let me know. The next morning they'll call and they'll say, you know what, doc? Actually, I was in a car accident 7 years ago or 10 years ago or 20 years ago. The car flipped 2 times and landed in a ditch. I lost consciousness for a few seconds. When I came out, I was able to walk. They carried me to the hospital right away. They told me everything was fine. I had one lady say to me, no, I'd never had a head injury. And so I said, all right, let's do the crown of thorns. And the next day I'll check in on you. The next day she said, you know, doc, I just remembered I was in a terrible car accident and I was admitted to the hospital after the accident. And they put these 2 steel rods into my head to hold my skull steady so that the neck damage wouldn't be too severe. And I'm saying, you do not remember this when I ask if you have a head injury? But that's another pattern that I'm able to establish because I'm doing this test so often that that I can trust it. Then I can say, well, even if I find something wrong with the neck or the skull, most likely the patient, for whatever reason, is gonna have no recollection of it. Maybe it's not so significant to them anymore. But the crown of thorns is for another day. Stories. My favorite story with the VitalReflex scan is a young lady who came to see me with really, really, really bad headaches. And she had been to the neurologist, she had been to, all the different specialists, and eventually they had told her that she had something called, idiopathic benign intracranial hypertension. I think that's what it used to be called in my day, which is that the pressure in the fluid within the brain is too high and it causes headaches, for which a treatment is not so clear. It has never been. And so she would have daily headaches. So we said, all right, let's put you on the bed. We'll do the VitalReflex scan and we'll see what we find. And I remember this young lady had several tattoos all over her body. Several is an exaggeration. She had like 5 or 6, several. And so we checked each of them to see if the reflex changed. The VitalReflex changed when we tested any of those tattoos. Tested the big one on her arm, nothing. Big one on her shoulder, nothing. One on the back, nothing. One on the thigh, nothing. One on the ankle, nothing. Then she had this really tiny tattoo right here on the wrist. And it was like the size of my fingernail. And I said to her, hey, the test shows that this is where your problem originated. And she laughed and she said, how could that be? There's no way. That tattoo is too small to have caused many problems. And I said, well, we tested everywhere else. And if you'll allow me, we could do a little bit of neurotherapy, inject the area for you, and you see how you feel. And she said, all right, sure, it can't hurt. I'm having a terrible headache now anyway. So we injected it, and I said, all right, hang on a little bit, let's see how you feel. So she's lying there on the bed, And I say, just try to describe for me anything that you're sensing, anything that's shifting. And she had her eyes closed initially, and she opened them and looked around, and she said the weirdest thing to me. She said, "Doc, did you just repaint all of the walls since I came in here?" And my mouth drops open. I'm like, "What?" She said, "The walls are all a different color. When I came in here, they were one color. And just since you did the injection, all of them have shifted." And I look around at the other people in the room, and I'm like, "What's going on?" And then she says, "Oh, never mind, it shifted back." And at that moment, the headache, boom, gone. So how do you even, once I see these things, it's so difficult to unsee them, which is why my whole career has shifted, because it's difficult to dismiss something as dramatic as that, especially when you have multiple cases where patients have not been able to figure out what's wrong with them. They've been to multiple doctors, and then they come to you. You find a very inconsequential or tiny little area of the body that needs some help. You treat, and boom, they're feeling better. You can't unsee that. And so my commitment to myself and to my patients is, hey, when you come to see me, we're going to do a VitalReflex scan in addition to everything else. So I'm going to ask you questions about your history, your medical history, surgeries, and everything. We're going to do blood tests as needed. We may do imaging as needed, but we're going to do a VitalReflex scan because I need to ask your body, as it were, the difficult questions so I can help you to be treated better. So once I unlock the riddle of what's sitting at the root of their symptoms, because the symptoms are here and the root causes are down here, then all I now need to do is to get better and better at how I treat the different root causes. And hey, we're going to have more and more people getting better. So I thank you for listening. It's episode 40. I couldn't think of a better way of rewarding you guys for sticking with me than to give you my secret weapon, the VitalReflex Scan. It's a complimentary feature of an appointment in person with me at Teshuva Wellness. And so if you're interested, booking information is going to be somewhere around here. And I thank you for listening. And if you have questions, I always welcome them. You know how to shoot them to me. I'll see you in episode 41. Look out for episode 50 because I personally am so proud of the fact that we made it to 40. Just imagine what we're going to do at episode 50. See you soon. God bless.
Don't forget to subscribe to our YouTube channel. Hit that subscribe button and turn on notifications so you never miss an update.
Thank you for listening to another episode of the Healthy Reasonings podcast. Remember to subscribe to this podcast so you can be updated as soon as new episodes are ready. If you have a question, send us a voice note on WhatsApp or a WhatsApp message. The WhatsApp number is 1-876-405-7831. For more information or to become a sponsor, please email wellnessdocjamaica@gmail.com. See you soon.